I often get approached about some myths about foot and ankle care. Broken toes, or if you can walk on the foot, it's not broken. You don't have to see a doctor or get a treatment if you just have a sprain. Some of these things can cause major injuries. If after 2 or 3 days you're still having pain and swelling and it just doesn't feel right, you should get it evaluated, because sometimes these things are a lot bigger than it appears, and swelling and injury can mask pain because it causes pressure on nerves and it can affect those neural pathways. So there are several myths such as sprains and broken toes don't need to be treated, because every once in a while they do require surgery or immobilization or more advanced treatments than just limping along and time and rest, ice, and elevation.